Patient-centered care is the vision. And in getting to patient-centered care, we think that folks in Washington, in terms of legislation following Obamacare, need to take 3 important steps. First of all, get the goal right. Don't focus on universal coverage. Coverage should not be the goal. If you make coverage your goal, you are going to put yourself in a policy box that will lead you to Medicaid expansion and to the individual mandate, and from there all the other apparatus of Obamacare. Second, so your goal should be reducing costs and expanding individual liberty, not expanding coverage. Second, accept that doing nothing is not an option. When I go around the country, talk to Tea Party groups, first of all, repealing Obamacare is their #1 agenda item. It's higher than balancing the budget. It's higher than stopping the debt. It's amazing. It's off the charts. And then I'll ask them, okay, but what should we do to replace Obamacare with patient-centered care? They'll say, nothing. Don't do anything. And what they mean by that, I think, is the government has screwed it up. The government will screw it up. Just get your hands off of it. What they don't often understand is the government has already screwed it up significantly, such that we have no choice but to try to reform, to undo the wrong things we've done. And so we have no choice then but to legislate. The third thing is, let's avoid replicating Obamacare inadvertently. And the way you would do that is by trying to do things like reform the individual market in ways that essentially abolish the price mechanism, abolish using health status as a factor. Health status should be a factor in insurance for the same reason that whether your house is on fire is a factor in fire insurance, or whether your car has crashed is a factor in auto insurance. So too it should be with health insurance. But of course there are people who have pre-existing medical conditions. Those folks need charity. They need help rather than mandates and more government.